Good morning, John Benko here, the Director of Nursing here at Belfair in Shaker Heights, Ohio, coming to you from an undisclosed location on Friday, November 13th. Friday the 13th. Sounds ominous. It is a little ominous for a couple of reasons. One, we're in the middle of a global pandemic, and two, that pandemic is thriving. The numbers are the largest they've ever been here in Northeast Ohio, actually around the world. And we are seeing case after case after case increasing daily. We have got many suppositions in why this is. Essentially, we think a lot of it is just due to fatigue. Folks are dropping their guard. They're not following protocols. So we need you to be very, very vigilant. When you're here on campus or any of our workspaces, we know that you're always wearing your mask, keeping your social distancing, cleaning your areas and your hands frequently. Please keep that up. When you're not here, be careful. Avoid large groups. Please do not go to social outings unless you are extremely well protected and following these protocols. What happens if somebody does test positive? I get this question quite a bit. How do we know, or if somebody tests positive, how do we know if we're exposed? I'm happy to report that that is an extremely well-developed, well-formed, and well-working process. Coward County and their Board of Health have done some great improvements since we first started talking to them in January. I communicate with them weekly, if not more. We have what we refer to affectionately as a COVID czar, Mr. Ben Wenger, who does contact tracing and some reporting with them. We work directly with risk and HR. We've got a very strong committee and a very strong process. So should one of our team members, one of your colleagues, for some reason take ill or really for whatever reason become tested and that test is positive, this kicks off a process that works quite quickly where we do contact tracing. We find out through direct interviews and some observations where that person was and with whom they were, at least regarding any times here when they were working with the agency and their colleagues. We review that information with the Board of Health, and those people are contacted if there is a deemed positive exposure. So if you were someone who the Board of Health, after all of our interviewing and observations, we get together with the Board of Health and find out that we think we've got a person that may have been positively exposed, which means they've been in a room with somebody who has since tested positive and they were in close contact and they were both unprotected, or they were unprotected to the extent that the positive person wasn't wearing a surgical isolation mask or something more restrictive like an N95 type. Then you'll be contacted. You'll be contacted immediately, and you'll be contacted by your direct supervisor. What you'll be told is that you were in contact with someone who has tested positive. What the criteria, or I should say what the protocol for that is, you need to be, when you're not working as an essential employee, quarantined. When you are working as an essential employee, you need to continue to wear a mask, a surgical isolation mask, or an N95. While you're working. When you're not working, you need to quarantine at home for that 14-day period. None of that has changed. This process has been in place. What happens with the contact tracing is from when you got your symptoms or from when you were tested positive, the contact tracer will go back 48 hours, and that is the period of time that's been well established to be what we're concerned about so far as contagion. So you will hear much talk over the next several weeks about someone who may be positive, or there was a positive person here or a positive person there. The way that you'll know if you were exposed is you will be contacted. Again, contact tracing is a very serious part of the mitigation efforts, both here on the campus, worldwide, and certainly with the Cuyahoga County Board of Health, who is managing the crisis directly with us for all things Belfair on our campus. We also do that contact tracing and the communication for any of our off-county areas, but I can't really speak to the aggressiveness of which those counties may reach out to the individual person. I can tell you that we manage it the same here. So you will always be contacted by your supervisor if it has been deemed that you have been exposed to someone who is positive for COVID-19. Our numbers still remain tremendously low, and so far as our residential clientele, those children who live with us on the campus, it is zero. We've got nobody positive, nobody who has got any symptoms that would suggest they may have COVID-19. So that is very good, and that's due to all of your efforts, as are those low numbers. So please keep those efforts up. Wear that surgical or isolation mask anytime you're with anyone. Please keep your distance. 6 foot or better, have a barrier between you. We should not be meeting in close proximity of each other. We know that we may have to for the clinical needs of a child that we're taking care of or a family. That's fine. Use your protective measures, but whenever you can, you need to be as far away from each other as possible. We should not be having close quarters meetings. Use the biggest room you can if you have to get together. Best would be if you use Zoom or the telephone. Meet outside. The weather's nice if you can do that. Get some fresh air. You need it. You need to keep the stress down, and fresh air is our friend. We want to keep circulating the air. If you're in a building that can open a window, open a window. It's a good idea. Hey, it's going to get bumpy, folks. We know that. The increase in cases is alarming. We are managing the disease, not the uptick in cases, but we know statistically as cases increase, so will exposures. Exposures lead to contagions. We're ready for it. We're going to continue to stay ready for it. We need your help. So please follow those protocols. If you have questions, reach out. If you're sick, stay home. Take that screening seriously every morning when you're being screened. Make sure that we get your temperature. Make sure you answer those questions thoughtfully. If you're not going to pass screening, don't bother coming in. It's way better that you stay home and get better than if you come in and potentially expose one of your coworkers. And most of all, we want you healthy. Mind your stress. You need help, talk to somebody. Do what you do to mitigate stress. If you need to reach that employee assistance line, reach out to HR, your direct supervisor. Email me. Email me with questions. I'll get them out to you. If your team, your group of folks that you work with, if you think you could benefit from some education or question and answer session, we could do that on Zoom. Reach out to your supervisor, tell them to get a hold of me, get those questions to me. I'll get them back to you. Information is our friend throughout this. It's not always what we want to hear, but we will get it to you. We are managing this very quickly. We have our emergency COVID management meetings reestablished on at least a weekly basis. I'm in contact with HR and risk and Ben Wenger, who manages, again, the contact tracing and all of the senior management as often as we need to be. So we are getting the information out to you as quickly as we can. Please understand that we are doing that, and we are following all of the guidelines in place to keep us all healthy, certainly our clients healthy, and we need to keep doing the mission that we're doing. So please be careful. Please follow these instructions. Mind your stress. Get help if you need it. Relax. I know this is a very difficult time, but we will get through it as we have for the last 151 years. And we do that because we've got great people working here who help each other. And I am so appreciative of that. So I hope that you and everyone you love are doing well. Stay safe. In the meantime, please wash your hands and stop touching each other. Have a great day.